It's a joy for me to not only introduce the speaker, but attend, because everything he's going to talk about is so important to all of us. Dr. Jacob Mirsky, our speaker tonight, is a primary care physician at Mass General Revere Health Center. He attended medical school at the University of California, San Francisco, and completed his residency in internal medicine at the Brigham and Women's Hospital in Boston as part of the Harvard Vanguard Medical Associates primary care track. Dr. Mirsky views healthy lifestyle changes through patient education and empowerment as the cornerstone of health. In addition to his primary care practice, he leads lifestyle medicine group visits, also called, which some of you may know, shared medical appointments in primary care for symptom management and disease prevention. Dr. Mirsky co-founded and is the medical director of the Division of General Medicine Healthy Lifestyle Program, HLP. The HLP has a vision of establishing healthy lifestyle change as the standard of care for preventing and treating chronic disease. He has received several awards to spread lifestyle-focused group visits at Mass General, including the Mass General Department of Medicine Phoenix Project Award and the Mass General Hospital Springboard Studio iSolve Grand Prize. He also serves as the Assistant Course Director of Harvard Medical School's Herbert Benson MD course in Mind-Body Medicine. As if that's not enough, Dr. Mirsky also founded the Mass General Revere Health Center Food Pantry in 2019, and he is now its medical director. It's a fabulous program. The Food Pantry treats both food insecurity and chronic disease by providing free plant-based foods to patients with food insecurity. And to further advocate for food insecurity interventions, he serves as a member of the Mass General Executive Committee on Community Health and the Greater Boston Food Bank Health and Research Council. This was worth your hearing and my reading. And in summary, he is both a primary care physician, so he treats individuals individually and as group. He also has a profound and important interest in policy, community, and in lifestyle change. So Dr. Mirsky, we invite you to begin the talk. And by the way, again, to review what Judy Willett said, please, as the program goes on, write any comments or questions in chat. At the end of his talk, I will be asking the questions you write and reading the comments you write. That's our way of handling, engaging you and everyone in the conversation. Finally, for those of you who, like me, start taking notes, you need not, because Dr. Mirsky has gracefully offered that anyone who attends will be able to receive his slides. So now I'm officially finished. Welcome, Dr. Mirsky. You're on mute.
Great. Well, thank you so much. You make it seem like I'm busy, but really I just watch TV all day. So I appreciate the kind words. But anyways, really, really nice to be here tonight. And thank you for the warm introduction. As you heard, I'm a primary care doctor and spend a lot of time thinking about changes that we can make to the healthcare system. And one of the things that I'll just start by saying, just to give a personal note, is that I actually found my way into the healthcare system through dementia. The first clinical experience I ever had when I was in college was working at a hospice unit that was just down the hill from the college I went to. And then after college, before medical school, I did research at the University of California in San Francisco's Memory and Aging Clinic. And one of the most fascinating parts of that experience for me was that I partnered with one of the social workers who led a caregiver support group for patients with dementia. And so in many ways, this is a really fabulous opportunity for me to have the opportunity to just share some of the thoughts that I have on medicine, and caregiving is one of those areas. Unfortunately, it's a long list of areas that we don't prioritize enough in the healthcare system as it exists. And so thank you to Judy and Barbara for creating this space, and all of you for coming to think more about this and to learn more about the many ways in which caregiving and chronic disease, whether it's dementia or any other condition, impact people's lives. So with that, I'm going to start off by sharing my slides here. So give me just one moment. I would have had this prepped well in advance, but of course there was a major crash on Storrow Drive when I was coming back from my clinic in Revere, so I didn't have a chance to set it up. But anyways, here we are. So I'm going to talk tonight about a number of different topics. Actually, I'm hopeful that by the end of the presentation, over the next 30 or 45 minutes, that I'll weave a little bit of a narrative together that touches on stress, touches on our brain and the connection between stress and the brain, touches on what's known as the relaxation response, which was discovered and popularized by Dr. Herbert Benson, who is the founder of the Benson Henry Institute for Mind-Body Medicine at Mass General. And then ultimately transition to talk a bit about the programming that we have in our Healthy Lifestyle program that Barbara mentioned. For those of you who do have a primary care physician at MGH, this would be a program that is available for all of you. And again, happy to see some familiar faces from patients that I've seen in the groups. I want to start by introducing the term lifestyle medicine, which is actually a relatively new term for a concept that's been around for thousands of years. Hippocrates is credited with a quote that basically said, let food be thy medicine and medicine be thy food. And so we've known that there's a clear connection between the foods that we eat for thousands of years. Certainly, the adage when I was growing up that everyone made fun of was eating more broccoli. And, I think we've come a long way from those days to really understand that food is integrally connected to our health, but there are also many other lifestyle factors or behavioral factors that impact our health. And this is now collectively called lifestyle medicine. So here is listed the 6 pillars of lifestyle medicine. These are the core of our Healthy Lifestyle program. And the American College of Lifestyle Medicine was founded about 15 years ago to simplify the overwhelming amount of information that's out there related to promoting health. And the reason that this is really important, and I hope many of you will recognize, is because our healthcare system actually isn't a healthcare system. It's actually a disease care system. It's built to take care of chronic diseases or acute diseases. There's actually very little that we do in our healthcare system that promotes health. And for people who experience chronic stressors, caregiving being certainly among them, but anything, a long list, which I'll introduce in just a moment, really there are a lot of ways actually that we know we can promote health in the setting of chronic stress. And so these 6 pillars are the basis of what we talk about in the Healthy Lifestyle program. Are 6 areas that I'm not going to touch base on all of these tonight, but I will touch base on primarily the blue pillar listed on the right, which is developing strategies to manage stress. I will emphasize, though, that the pillar below it, forming and maintaining relationships, is one thing that we now know is really critically important, especially as people get older. That social connectedness, which does not have to mean, or by definition does not mean intimate relationships. It means connections to friends, family, coworkers, neighbors, or even, I would argue, a smattering of like-minded, interested folks like this Zoom call here tonight is a way that we tap into something that's really powerful to promote health. Other areas that we focus on are sleep, avoiding risky substances such as alcohol and tobacco, and then, as I mentioned before, eating healthfully, and then finally increasing physical activity. So all 6 of these are really gateways, potentially, for managing stress. So even though one of them is strategies specifically to manage stress, so this is stress reduction techniques or practices, each one of these other 5 pillars can be really, really effective for stress management. So relationships or social connectedness can be a major source of stress reduction for some people. Alternatively, many people, when they're feeling stressed, will simply go for a walk, or will go to the gym, or will swim, or will do some sort of physical activity that helps to bring down the acute stressors. Some people will turn to substances like alcohol or tobacco, and actually developing strategies or techniques to reduce the reliance or the connection between stress reduction and those actually promotes health quite significantly. So each of these can be impactful in their own right. But what I really want to focus on for the next few moments is just talking about stress reduction practices themselves. And the reason it is so important to talk about stress reduction practices in general, but particularly these related to stress as a whole, is because we all experience stress. And stress isn't just when terrible things happen to us or when we're completely overloaded or overtaxed on a day-to-day basis. Stress itself is just the response to any demand that we experience as the day goes on. So this can be positive or it can be negative. So for example, when we feel hungry and then we choose to make lunch, that's responding to our body's perceived stress of not having enough nutrients. It's a minor stressor, and it's a stressor that we can handle quite readily, but it's a stressor nonetheless. And so if you think about all of the demands that we respond to every moment of every day, to stand up to go to the bathroom, to go to the kitchen to make some food, to call back a friend who left a message earlier, each of these are small stressors that over time can really accumulate. And when our stress levels go too high, our bodies experience it really in one of 3 ways. So this is the fight, flight, or freeze response. So extra stress, excessive stress causes our bodies to have one of these 3 responses. And it's not just physical, it's also emotional and relational as well. So some of us will find that when we experience stress, we respond in the moment by fighting back. And again, that can be trading a barb with someone who said something mean to you. It can be yelling at someone on the phone who's not giving you the proper information that you're looking for. Or it can be physical, that we can feel tense. We can get ourselves into a position where we're actually engaging and fighting. And so many people will feel physical tightness when they feel stress, because that's our body's natural system of getting ready to fight. Other people will experience flight during stress. This is the sensation of needing to get away. Some people will feel this relationally, where they shut down and stop talking with friends, family, coworkers, etc. Other will find it where they don't engage in the stressor at hand, which certainly from a caregiving perspective could include any number of needs or demands that come up during the day. And then finally, freeze is the feeling or the sense of overwhelm that prevents any type of action, whether it's fighting or fleeing. So freeze is that sense of numbness, detachment, not wanting to think about or engage with what's going on. And so over the course of the day, when our stress gets to the level where it's excessive, or it gets to the point where it's causing some sort of negative impact on us, the negative impact usually comes out as a result of fight, flight, or freeze. Now, what actually happens in our bodies to describe or to explain this is that our natural fight or flight or freeze response system is tapping into an evolutionarily very, very, very old system that activates the stress response. So physiologically, as far as changes that take place in our body, there are a number of acute physiologic processes that get activated because this system developed over many, 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 many years. So the predecessors for us before humans existed or apes existed or chimpanzees, the predecessors of mammals had very, very small brains that still had this functional part in the bottom that was called the bottom-up processing network. And so when our, let's say, reptilian ancestors were swimming along the side of a river and a big fish came by and they got stressed, the same exact thing happened in their brain. The brainstem, which is this bottom part of our brain, and their amygdala, which is the fear part of our brain, got activated. It kicked off this stress response, and different organs in the body had a physiologic change that allowed the body, without thinking, to respond to that stressor. So our blood pressure can go up, our heart rate can go up, our digestion and immune system go off. And that's because if our reptile ancestor felt like they were about to get eaten by a big fish, the blood pressure and heart rate goes up so that they can rapidly get away. So more blood and oxygen and sugar goes to the muscles to actually move. And in contrast, if a little reptile is about to get eaten by a fish, it doesn't matter if they're digesting breakfast from that morning or if they have an infection that they're fighting off, because if their head's about to get eaten, none of that really matters. So this stress response system is the physiologic basis for how we can respond to all of those different stressors that come up over the day. So we have this system built into us. The problem, though, is that if the stress doesn't go away, a cycle develops, which is called the stress response cycle, where the chronic stress activates the stress response activates these changes in the body, and then these changes in the body themselves cause more stress on our cells. So they add to the original stressor. That causes more activation of the stress response, more changes in the body, and this loop develops. And when this loop develops, because our immune system gets changed in it, there's this chronic stress phenomenon that leads to chronic inflammation. And so lots and lots of problems start to come up because chronic stress is taking place in the body. Now, this exact system still exists in our brain and our bodies, and now we have names for a lot of the things that we call chronic stress or we call chronic inflammation or chronic disease. The stressors that we experience are many. You can see some of them listed on the left, which can include the inner experience of physical illness, mental illness, or a history of trauma, but also the outer experience of the pandemic, finances, work, retirement, marriage, divorce, or other family members, certainly caregiving. This taps into the exact same stress response part of our body, which taps into the same exact physiologic processes in our body, releasing cortisol, the stress hormone, adrenaline, noradrenaline. Inflammation over many years can accumulate, and the end result of it is actually the many chronic diseases that we know about. Obesity is a result of chronic stress and chronic inflammation changing our metabolism. Hypertension or high blood pressure and diabetes are influenced by chronic stress and chronic inflammation in our blood vessels and in our pancreas, as well as the fat cells and other cells in our body that normally metabolize sugar. Inflammation in our heart and in our brain can lead to chronic diseases like coronary artery disease, anxiety, dementia. Chronic pain can get worsened by chronic inflammation. As I said, anxiety and depression can also be exacerbated, and substance use disorders as well. So it's not to say that stress and inflammation are the only reasons why chronic disease exists, but they are major contributing factors for virtually every chronic condition that we know of. So one major takeaway then is that chronic stress leads to chronic inflammation, and chronic inflammation contributes to chronic disease. So this is one big takeaway that I want to make sure comes through clearly. And then related to that is that there's actually a lot that we can do to counteract all of this. So understanding that chronic stress and chronic inflammation are really pivotal and critical for chronic disease progressing, it's important to highlight that our body also has a natural anti-stress response. So Dr. Benson, who I mentioned, discovered and popularized this concept of the stress response system, was also known for discovering the relaxation response system that counters it. He did research on this actually in Boston at Beth Israel Hospital in the 1970s and published on this. He wrote a little red book, which some of you might have seen or have read. And in the book, he describes the relaxation response, which is the body's natural ability to lower or counteract the stress response. So instead of activating those bottom parts of our brain when we experience a stress, we can actually choose. We have the power to preferentially activate the front parts of our brain. And when we do that, that kicks off the relaxation response. The relaxation response has the opposite effects on the body that I mentioned before. So blood pressure comes down, our heart rate comes down, our digestion and immune system return back to normal. And this has a positive feedback on the stress that we experience itself, so that over time, our stress levels come down. Now, the relaxation response might seem magical, or it might seem hard to obtain, but in fact, it's really quite simple. It's not easy to tap into the relaxation response, but it's simple. The relaxation response is brought out when there are two key processes that take place. One is that we focus our attention on something that's either neutral or positive. Usually that's repeated over and over again. So this can include the breath, like a breath-focused meditation. It can include a movement like yoga, tai chi, or qigong. It can involve words, which could be a mantra or a prayer. And many people actually find the relaxation response comes out with other repetitive activities like cooking, cleaning, gardening, walking, cycling, swimming, etc. So really, it doesn't matter what it is that we're focusing on. What matters is that we're focusing our attention on something that's repeated over and over and over and over again. And so when we focus our attention on that process, we're activating the front parts of our brain. Now, naturally, what happens, as I'm sure you can imagine, is that when we try to focus on something, thoughts pop in, distractions pop in. We remember that we didn't lock the front door. We think about the mustard that we have to buy at the supermarket. You remember a text message that you got 2 days ago, or a task that you have to deal with later that day. These are distractions from the task at hand, which is focusing. And so it's important to not judge or to be discrediting of those thoughts or feelings that come up when we're trying to focus. What's important is that we build a sense of awareness to just notice that the thoughts are happening, we let go of them, and we return our attention back to focus. So when I mentioned earlier that lifestyle medicine includes developing strategies to manage stress, this is really one of the key ways to help reduce stress. There are many others, which I highlighted earlier, can include physical activity, promoting health that reduces chronic inflammation, avoiding substances, improving sleep, and relying on healthy relationships. But developing strategies for stress management specifically through the relaxation response is one really critical way to do this. Now, some of you might be thinking that this necessarily means that, I'm saying you have to meditate for 30 minutes every morning, or that you all of a sudden have to start going to Tai Chi classes. And that's definitely not true. So one of the main messages that we get across in our Healthy Lifestyle program is that starting slow and finding a path into this that is comfortable and realistic and doable is actually the best approach. So if you've never tried a breathing meditation before, maybe initiating a 2 or 3 minute practice every morning while you're waiting for the water to boil for your coffee could be one place to start. Or if you show up for an appointment with someone you're caring for and you're waiting in the waiting room, instead of checking your phone, maybe noticing your breath and paying attention to that there. So lots of ways to build this in. And in fact, this is one of the main areas that we focus on in our Healthy Lifestyle program is through our group visits, which I'll share in just a moment, that really highlight the importance of resiliency. So resiliency is our ability to adapt to challenging life situations over time And stress reduction is one of those key practices. And so we spend a lot of time talking about that. And I'm happy to take questions at the end related to that. One of the other things that we also talk about in our program, our Healthy Lifestyle program, are all the ways in which these 6 pillars of lifestyle medicine impact our brain as a whole. And so we've worked with the McCant Center for Brain Health at MGH, which is has built a mission of incorporating lifestyle change, lifestyle medicine into primary care and the healthcare system as a whole, as one way to counteract what I said before, which is the nature of the healthcare system being really a chronic disease care system. And so we've worked with the McCant Center to build a brain care series that focuses on 4 different aspects of brain health. So in the beginning, we do an introduction to brain health. In the second part, we talk about lifestyle factors like nutrition and physical activity and stress and sleep, and how those all affect brain health itself, meaning dementia, stroke, anxiety, and dementia and depression risk. We also talk about physical measurements of body health that have a major impact on future development of brain disease, which can include blood pressure, blood sugar, blood cholesterol, and body mass index or weight. And then finally, in the 4th session, we talk about the importance of social and emotional care related to brain health. So again, we pull back in this concept of stress reduction, stress management. We then focus on social connectedness as a way to improve brain health. And then finally end with a discussion of purpose and meaning as one really critical factor in brain health. And the reason we built this program and the reason we highlight these 3 main areas of brain health factors is because actually a lot of brain disease is preventable. So the McCant Center has highlighted for us, which we show in our program, that up to 40% of dementias can actually be delayed or prevented through lifestyle change. We highlight that up to 50% of strokes can be prevented, and also that up to 40% of major depressive episodes can also be prevented. So lifestyle medicine not only is really helpful for thinking about chronic diseases like diabetes, high blood pressure, heart disease, liver disease, but it's actually really critical for brain disease as well, and the opposite, brain health. This was shown recently in a major research study that was published in the British Medical Journal, one of the most prominent medical journals in the world. This was an analysis of people who were at risk of developing dementia but had not yet developed it, and looked at how that risk changed over time as people got older, depending on how many healthy lifestyle factors they had. So on these 2 graphs, which show women on the top and men on the bottom, on the left is people who are age 65. And as you go to the right, it's people's age going up to 100. And on the side here is the percent of people who are living with Alzheimer's dementia. So at age 65, both men and women had a very low rate of Alzheimer's dementia. And over time, understandably, the rate of dementia went up for both men and women. But what you'll notice here is that for those people who had 0 or 1 healthy lifestyle factor, which is shown in this purple line, they had the highest rates of dementia at pretty much every single age. For those who had 2 or 3 healthy lifestyle factors, they had the middle risk of developing dementia, so below the purple line for both women and men. And then the lowest incidence or rates of developing dementia were seen in those people shown here in the dotted red line who had 4 or 5 healthy lifestyle factors. And this is not a subtle change. So for example, if you look at people who are 80 years old, so right in the middle of this graph, for women, the risk of developing dementia, Alzheimer's dementia, was cut in half from 45 to just over 20%. And for men, similarly, the rate was cut in half from about 35% to 15%. So there's actually a very clear link between lifestyle factors and brain disease. And this is why the McCants Center has made this a feature of the work that they do. The way that they have operationalized this so that people like you and friends and family and patients that I see in clinic can benefit from this is by developing what's called the Brain Care Score. The Brain Care Score takes into account all of those factors that I mentioned earlier, which are lifestyle factors, measurements of body health, and also social and emotional health. Put them into a score and then can use that to predict the risk of either dementia or stroke in the future. And many people find this really helpful as a motivating tool to then identify one area to work on to try to reduce that risk. And so that's what we promote in our program. It's not changing everything about your life, but really to identify one way that maybe you can improve your overall health and as a result, improve brain health. Perhaps it's focusing on improving nutrition. Perhaps it's focusing on reducing smoking. Perhaps it's reducing how much alcohol you drink. Perhaps it's moving more, exercising, signing up for a class at the Y or at the local gym. Or maybe it's improving your sleep by trying to commit to going to bed earlier or waking up later or reducing naps, whatever it might be. So we found that identifying one area of focus can be really, really helpful for people. And we also have benefited from incorporating health and wellness coaches, which is a new role in the healthcare world that is rapidly expanding its prominence. Because just like players need coaches on the field or on the court, we as patients need coaching too. There's a lot of information to take in. There's a lot of decisions to be made, and coaches can really clarify what's important for you and how to make those changes. And one way that our coaches do that is by helping patients set goals. And the way that we encourage goal setting is by asking the question, what do I want to do? But then also, how will I know when I've accomplished it? So we don't want people to set unrealistic goals like Boston Marathons in, I don't know, 2 or 3 weeks, I'm going to go run the Boston Marathon. If that's completely unrealistic, then really there's no point in setting that goal except to set you up for failure. So we like to encourage patients and work with patients to set goals that really set you up for success. The way to set up goals for success are to follow the SMART acronym, to be specific about what you want to do, to measure what you want to do, to make sure that what you want to do is attainable, to make sure that it's relevant to the larger health goals that you have, and to make sure that it's time-based as well. So for example, if you hear this talk and you say, oh, I'm so excited, I'm going to walk more. That's great. And I commend you for wanting to walk more. Walking is a wonderful activity and there's lots of benefits, but it's not a very smart goal in this sense. One way that you might think about modifying it is to say, over the next week, I'm going to commit to walking for 15 minutes around my neighborhood every morning after breakfast. That is specific of what you're going to do, where you're going to do it, and when you're going to do it. It's measurable because you can time how many minutes you're doing the walk for. It's hopefully attainable, meaning that you can actually make that happen over the next week. It's relevant, hopefully, to a larger goal of improving general health and brain health, as well as reducing stress. And it's time-based because you're setting a target that's just a week away. So this combination of educating patients on the connection between lifestyle changes and chronic disease, as well as using this coaching model to think about actually making lifestyle changes in a sustainable way, is the basis of our Healthy Lifestyle program that's in the Massachusetts General Hospital Division for General Internal Medicine, primary care. So our Healthy Lifestyle program, as Barbara mentioned earlier, has a vision of establishing the practice of healthy lifestyles as the standard of care for the prevention and treatment of chronic disease. And the way that we do this is through the use of a relatively innovative approach to care delivery that's actually been around for about 30 years, but has gained more and more popularity over the past several years, which is this idea of group medical visits, which because of COVID, we're now using virtually. So a virtual group medical visit, or VGV, is actually pretty similar to what we're doing here. So we have a number of patients across Mass General's primary care come into the same Zoom room at the same time with the same interest, whether it's managing high blood pressure, managing diabetes, learning more about stress management, or brain care, as I mentioned before. And for an hour, we're all in the same Zoom room together. And the first half of the Zoom talk, a provider, which could be myself or one of the other 14 physicians or nurse practitioners in our program, we educate patients on one topic that can help motivate them to make behavior changes. So we talk about the connection between salt and blood pressure. We talk about how to start a meditation practice. We talk about the importance of social connectedness and loneliness and isolation as it relates to brain health. So we have different topics around all sorts of chronic conditions and symptoms and skills. And the first half of the program is really educating patients like you, as I'm doing now with the presentation. In the second half, though, we stop sharing the screen, and every patient has a conversation with everyone else listening in the group, with the provider who leads the group and a health and wellness coach, to talk about one step you can take towards a healthier future. So patients can talk about goals that they might have around nutrition, around physical activity, around alcohol, smoking, sleeping. And we use the coaching model to help get people a little bit closer to the SMART goals. Not everyone gets there right away, and that's totally fine, because all of our patients who come to our group visits are then available to do one-on-one health and wellness coaching for free after the groups, to take what they've learned and started to think about and really put it into practice on a day-to-day basis. In general, we have about 6 patients who come to our groups. We offer groups in the morning, afternoon, and early evening. And in fact, we're now the largest lifestyle medicine group visit program in the country. So we started this program in 2020, at the very beginning of the pandemic. And it's been a tremendous ride, building the program and incorporating a lot of the experiences that we've had from patients giving feedback to us to modify our program and expand it. So we now have 15 providers, and by December, we'll have 18 providers running group medical visits. We have 5 health and wellness coaches. We offer groups and coaching in both English and in Spanish. And the 7 group visit types that we have to offer are high blood pressure or hypertension, which is our flagship program, pre-diabetes and diabetes, brain care, as I mentioned before, insomnia, stress reduction, nutrition for health, and now culinary medicine, which is run by Dr. Delicacios at Beacon Hill Practice. For those of you who do have a primary care doctor or take care of a patient who has a primary care doctor at MGH, you hopefully will have seen our flyer, which is should be in every clinic at this point. So the flyer clarifies the 7 different group visit types that we have to offer. Also has a QR code that can be scanned, but the flyers now have a little website link that you can type into your phone. And then for all of you who are, or for any of you who are not able to connect over the internet, any patient can call our wellness center at 781-485-6400 to get more information. And then the last thing I just want to mention, and I'm just going to pull this up real quickly. The last thing just to mention is that we've worked really hard to build an online presence to help folks like you who might want to join the program to learn more about what groups are coming up, when are they coming up, and how to sign up. So what I'm going to do is put a link in the chat right now to our website. This website has an updated calendar of every group visit that we're going to be running, and it will continue to update. It also has links to other resources, explains a little bit more about lifestyle medicine, group visits, health and wellness coaching. It has a patient testimonial video. So for anyone who's interested in learning more about the program specifically, please check out the website, or you can call our front desk to get more information. So that was everything that I wanted to share tonight. I'm sure there'll be some questions, so happy to answer anything that comes up. So please type in the chat, and Barbara, I'll pass it back to you.
Yes, Dr. Mirsky, it's wonderful. I've learned so much. I'm one of the people who, in hearing you speak, would decide tomorrow I'll run the Boston Marathon. So, and of course I won't because I don't run, but I did hear the important message about how to begin is as important as deciding to begin. So the first two questions, actually, I wound up putting in a question that Nancy had done first. That Nancy had, she said, can the methods of responding to stress reduce the effects of chronic disease already existing in addition to prevention? What I was thinking, just to augment, is many of the people here today are living with or caring for people with dementia already existing at, of course, different levels. So can you just speak to the general question that Nancy asks? And then also, if I care for someone with dementia, should I start something? Does it pay to begin a routine? Please speak to those important topics. And you're on mute. Oh, okay, you know that. All right. Oh, please unmute you. Okay.
Yeah, thank you. I accidentally put myself on mute. Yeah.
Okay.
And I couldn't get out. So these are really great questions. So there's a long literature that really shows that anyone can benefit from the relaxation response and stress reduction practices. So that this really should not feel like and is not something that is unattainable, is magical, is ethereal, is off in the distance. Really anyone can benefit. And in fact, in one of our group visits that we run on introducing meditation and mindfulness, we practice a brief 3-minute meditation. And even in just 3 minutes of calming the mind and focusing on the breath, many people can immediately feel a sense of calm, a sense of peace, a sense of quiet. And so absolutely the effects of stress we feel all day, because we really don't have control over a lot of the stressors that we experience, either externally or internally. But the ability to bring the stress level down, even just to turn the volume down from 10 to 8 or from 8 to 6 or from 6 to 4, we really do have the capacity to do it at any point. And it shouldn't matter whether someone has a physical illness, whether someone has a mental illness. Mind-body practices and stress reduction practices have been shown to be useful in a wide range of chronic medical conditions. And dementia is definitely on that list. So one of the challenges with dementia is that our natural ability to buffer stress can be compromised. And this can lead to agitation, it can lead to behavioral issues, it can lead to depression or anxiety that comes out with dementia. And so utilizing stress reduction practices, of course, tailored to a person's needs and abilities, can absolutely be something that can be brought in.
That's terrific. Thank you. One quick comment. For many individuals with dementia, and even for many of us, we recommend routine in the course of the day, which for the person with dementia, which accomplishes many, many things. But it occurs to me that routine, when practiced over and over, especially for an individual who may not have the cognitive capacity to engage in a specific activity, becomes the repetition that you're talking about.
Yeah, and I think also, some of the stress reduction practices I mentioned, like meditation or mindfulness, does require a certain amount of cognitive abilities. It requires, paying attention to a particular practice, which might be difficult for some patients. Mm-hmm. However, there is, and better than I do, but there is evidence around the importance of other stress reduction practices like music or sound, or even touch therapies like massage, as well, because I think those also tap in to the brain's natural ability to focus on a present awareness of something that's happening, rather than being stuck in some sort of stressful cycle that might be triggered by something someone said or by something that might seem off in the environment. So using non-cognitive skills or strategies, again, like sound, music, or even touch, can be really helpful also.
Thank you. Two questions which I think reflect the eagerness of everyone to be part of this. One is this virtual group resource available to those outside of Boston who are not patients of Mass General? Followed by, is the program available for those of us in Western Mass? My GI doctor is associated with Mass General Brigham.
Yeah, so thanks. Those are great questions and appreciate the eagerness. So right now, our primary care program is available for any patient who has a primary care physician at Mass General Hospital and who is physically located in Massachusetts. So for those of you who do not have a primary care physician at Mass General, there is an opportunity to potentially benefit from these groups if you see a specialist at Mass General that runs a group visit program with our team. So we have already started to develop groups in oncology, cardiology, and nephrology, so kidney transplant. We're hoping to expand this year into gastroenterology, as well as pulmonology and endocrinology. So hopefully there will be more groups available as we spread into the other specialties. But right now we are a program that's only available either in primary care or in the specialties for patients at Mass General.
Thank you.
I will say, sorry, Barbara, we'll just mention one other thing too, that from a stress reduction perspective, what I mentioned is based on work that's done at the Benson Henry Institute at Mass General. That is a program that starts, or at least all the clinical care at the Benson Henry Institute is initiated by a one-on-one consultation with a physician or nurse practitioner there, and to be seen for a consultation or to eventually do their 8-week group program as well. That does not require having any connections formally to Mass General previously.
Thank you. An important comment from someone who said, and I think we all hear this a lot and maybe feel it, how can you possibly calm the mind when there are so many stressors, not only about a parent perhaps living with dementia, but also our life, job, relationships, community, and on and on and on?
Well, it's a great question, and it's a very humbling one. And I think before I answer the question, I first just want to honor the fact that people experience a tremendous amount of stress. We live very, very stressful lives. Everyone has their own different collection of stressors at play. But the question, I think the comment behind the question is that we really live tremendously stressful lives. And so the first part to address stress is to think about what priorities we have as we go through our day. And so what I hear in that question about parents with dementia, jobs, relationships, finances, and then how can you find time for me? That really indicates that me is at the bottom of the list. And one thing that we work with patients, and when I see patients in primary care clinic, I really try to think through, is there a way to prioritize self-care just a little bit higher? That there's always competing interests for everything. And unfortunately, when self-care is at the bottom, it means that the self is who suffers and who experiences the negative effects. And so one way to think about kind of the comment before I actually answer the question is just to reflect and say, how much attention or care are you as individuals shining a light on yourself and your own needs? And I'm sure as caregivers, you've heard the metaphor around putting your own oxygen mask on before the oxygen mask of others. And it really is true that the people you care for, as well as the coworkers you work with and the neighbors that you live next to and the partners that you have, they depend on your own well-being. So prioritizing your well-being is critically important. With that in mind, I would say the most important thing is to start slow and to think, what is one thing that you can do? If you can't do it every day, what's one thing you can do every week? Mm-hmm. Something as simple that we talk about in our stress reduction groups from a social connectedness perspective. Is there one friend that you can call for a quick chat? someone you haven't spoken to in a week or a month or a year or maybe a decade. And if a chat is too much time, you really are too busy to have a chat, is there a friend that you can text to spend 30 seconds reaching out and saying that you're thinking of them or you're missing them? Another quick strategy related to stress management and resiliency is promoting positive thinking and positive psychology. And so one practice around that is gratitude. And so one of the techniques that we talk about is starting a gratitude journal, where you write down 3 things that you're grateful for every day by starting each of the 3 with the words, I am grateful for. It's something I do every morning, and I've done it for many years, not as consistently, but during COVID, I started doing it much more consistently. And it's phenomenal. It's phenomenal to recognize that in a minute, to write 3 things, literally 1 minute, you can see the world in a different light, to be grateful for the sun rising in the morning, to be grateful for a roof above your head, to be grateful for coffee beans that are waiting for you, or to be grateful for a parent to still be alive. There are things that can be shifted in the way that we approach our stressful worlds. It takes time and it takes energy and it takes a lot of practice. So I don't have a quick answer, and I apologize for going on for too long. But I think this question is really highlighting the importance of learning more about mind-body medicine, learning more about how stress impacts us, but also how we can meet the stressors, what we call resiliency, to not let it be so crushing or to be so detrimental to our mental health, but then also to our physical health as well.
Dr. Mirsky, going on has been eloquent and helpful. If you had a pithy, short phrase, you wouldn't be the respected, important physician you are. And because you said early on, and this is something that's coming up in some of the conversation, sometimes when many people hear, take care of yourself or manage your stress, they think that they are being told to go off to the Berkshires for 3 days or go, get a massage for 4 hours. And of course, if only, but you made very clear just now, a gratitude journal, a 30-second breath experience. So I think that that's really important. The other piece of that, which has come up in comments, as sadly, many people who do figure out it's okay to take care of myself to stay alive, worry that they're going to be thought of as selfish. And that's a huge mountain for many people to climb, but it does exist. And I'm sure you hear it all the time. Can you comment?
Yeah, of course. This is something that comes up a lot in our groups, and I think about a lot in the context of patient care, just as a primary care physician. Which is to say that I think this belief that we don't care for ourselves, we can't care for ourselves, we shouldn't care for ourselves, is just a belief. It's just a thought. And it comes from a culture that has, I think, influenced the way that many of us see ourselves and see our lives, which is to say that we live in a culture where I think we are expected to battle through, to power on, to disregard and to overcome. And even though my personal perspective, this is more personal than professional, I'll just say, I think even though that's a commendable and perhaps heroic way of thinking about how to deal with life stressors, unfortunately, I don't think that it has been time tested or shown to be true. That in fact, people who put on hardness and who disregard stressors, people who I'm just thinking about in the military who literally fight the fight, are brave enough and courageous enough to fight the fight, they ultimately suffer. And coming that approach to life of being hard and being resolute and ignoring the stress, it pays a toll. And I've taken care of many veterans, I've taken care of many non-veterans as well, where the effects of chronic stress could not be clearer. whether it's depression, anxiety, PTSD, or physical health, chronic disease related to behaviors, smoking, drinking, etc. So I don't really believe that there's a strength to this argument that we have to be quote unquote strong by persevering and pushing through. In fact, and a lot of the research and experience in mind-body medicine proves this, that there's actually a tremendous strength in softening. And there's a tremendous strength in turning towards the stressors that we experience, because that provides an opportunity to engage it. And it provides an opportunity to actually heal. So when we shine a light on the stressors that we experience, which could be caregiving, it could be the pandemic, when it's isolation, when it's physical pain, when it's seeing a loved one suffering, when we shine a light on it, that actually allows us to heal. And I'm in the healing profession. So I think anything that allows us to be stronger and to be resilient enough to live with the stressor, not ignore the stressor, is actually tremendously powerful. So I encourage, I want to be very clear, with professional support and with medical or psychological guidance as necessary, I think turning towards the stressors that we experience and the effects that they have on our mental and physical well-being is actually very powerful, and is actually a very strong way of engaging in the world that we live in.
Thank you so very much. There are a series of comments about in my case, my mother, who's living with dementia, age 75, is not interested in anything and super stubborn. So this is a conversation about, I want to engage the person with dementia in, be it an activity, a routine. And Donna says, I have the same with my husband. And someone says, my mother changes her mind often and gets stiff and refuses to do stuff. Now, what we all know is that becomes a source of stress to the caregiver, if you, of course, speak to that. And I want to just add, I think then as a caregiver, we're going to learn everything. We want our parent, our spouse, our relative to do it all. We want to do it all right, whatever. And isn't that often a trap? That
it is, yeah. And I think it depends on what you mean by do it right, because again, I think we live in a culture that sets a standard that we should always respond, that we should always do, that we should always engage, that we should kind of fight back or engage in that fight or flight response by fighting or flighting. But I think that it can be a harmful way to approach stress, because there are many things that can't be solved or fixed quickly or immediately or at all. And so one of the factors in stress management and resiliency that the Benson Henry Institute promotes, that I learned from the Benson Henry Institute, is this concept of stress awareness and taking a moment to analyze a stressful situation and to ask yourself a very important question. And the question is, can I fix or solve or problem solve or change the situation? The act of asking that question can be very powerful, because if the answer is no, then Barbara, to your point, you're setting yourself up for a lot of pain. Trying to change something that can't be changed is, by definition, a futile effort. And so if I try to change the sun from rising every morning, I'm going to be very disappointed every morning. Right? On the other hand, if I want to change whether the sunlight's coming into my bedroom by putting up the blinds, well, that's something I can change. And so, this is a tongue-in-cheek example, but I think it exemplifies that it can be really, really powerful to take a moment to stop and pause when a stressful situation comes up. And it could certainly be a mother who's being stubborn, or it can be a mother who's changing their mind. and to ask the question, can I change the situation? If the answer is yes, then that can be very empowering to think through, how can I problem solve the situation? Can I reorient my mom to a different reality? Can I provide my mom with a medication that might help with mood? Can I change the situation for both of us? So there might very well be a problem-solving approach that you can take and should take and will take. And that's a great way to address a stressful situation.
That's
on
terrific.
the other hand,
Yeah.
oh,
No, keep going.
yeah. And then on the other hand, if the answer is no, then that's a really tricky spot to be in, where you want to change something, you want to address something, but you can't. And that's where acceptance comes in. And acceptance is a very powerful practice. It's a very difficult practice. It's one that many people spend their life trying to, to develop or understand or perfect. And I don't want to claim that I'm an expert on that or anything else that I've really talked about tonight, but just to share some insights that have been passed on to me and I've seen work for other people. But learning acceptance can be really, really important, because when we accept something for what it is without trying to change it, that in its own right is an act of self-compassion, what I was mentioning before. That's a way to give yourself a break, to give yourself a pass, to give yourself an opportunity to maybe laugh at a situation or to calm down the intensity of a situation. And acceptance can be hard. It can require, there are many different skills that can be developed to promote acceptance, but it can be a really powerful approach when we recognize that we can't change a situation.
Thank you. And by the way, someone suggested in terms of ways to turn down stress, turn off the news. That might be something that some people can do since it's 24/7. There's a comment.
Yeah, Barbara, sorry, I would just highlight that's exactly the point I was just making, which is to say, if you're feeling stressed, and maybe it's because you're sitting on your couch watching your news, you can ask yourself the question, can I change the situation? And the answer is yes, you can turn off the news.
It's wonderful. And some of the comments were to respond to you, can I fix or change the situation? And then someone says, well, the answer is no, there's nothing that can be done to change that. And you just spoke to that. And that's when we talk about what is hard to do, but the work towards acceptance. I'd like to read this comment. Focus and awareness, this is going back to what we would wish for, is a good way to handle stress. I agree. For many of us, it's the 10% of the time when we just can't handle it. How do we manage to do focus and awareness 100% of the time? Any suggestions?
Well, I think the question that you're asking, or how I'm interpreting it, is to say that some of this, well, this person might particularly feel like you have the capacity for focus and awareness 90% of the time, and you want to get to 100% of the time. So how can one change the relationship with stressful situations to increase or improve the ability for focus and awareness to come into a present moment more frequently, more regularly? And again, I would highlight the value of stress awareness as a really critical step here. I think a lot of people suffer, myself included, to be clear, from engaging in the stress response, the fight, flight, or freeze, as a reflex. Mm-hmm. So during that 10% of time, a stressor happens, and automatically we engage in our natural stress response practices, whether it's a thought, a feeling, a behavior, something you say, something you do, something you eat, something you smoke, something you drink. These are all behaviors that can become very reflexive. And so I think what this question is alluding to is the 10% of the time where we're not aware of the stress, but we're automatically experiencing the stress response as a reflex. So one of the strategies that we promote in our program that again comes from the Benson Henry Institute around stress management is to heighten the awareness that stress is happening. And again, we experience stress in one of 5 main ways, which is thoughts, feelings, sensations, behaviors, and in our relationships to others. And so actually building a awareness practice through, for example, meditation or Tai Chi, that's like building the strength of a muscle when you go to the gym. The more you do it, the more you can be aware when your mind wanders as you're trying to focus on something. And so building that muscle can then translate to a heightened sense of awareness during that 10% of time. So that when you notice yourself getting agitated, when you notice yourself reaching for a bottle of wine, when you notice yourself going to Twitter or CNN or Fox News or whatever it is to get some sort of hit of dopamine of new information, to be aware that that is happening is then an opportunity to pause and then to pull in what I was saying just before, which is asking yourself the question, can I change the situation? So I think the answer for how to build more awareness and focus in the present moment is to build more awareness of stress before you even have the opportunity to bring focus and awareness into the present moment, to get out of that fight or flight or freeze response so that you can then activate by choice the front parts of your brain.
Thank you. That's so helpful. You're talking about most of us, many of us, I need to heighten my awareness that stress is happening because sometimes we just don't. It's just reflexive. That's so very helpful and important. Let's see. By the way, for everyone, I have added the Benson Henry Institute website if you on chat, if you want to look at that. I wonder, Dr. Mirsky, if you could speak a little bit about sleep. And I know it's one of the 6 pillars, and you didn't focus on that today, but I hear, as I'm sure you do, so often from hardworking caregivers, hardworking people that actually they are sleep denied, sleep deprived, and by the time their relative finally goes to sleep, that's when they then stay up for 2 or 3 hours because it's private time. So it is an understandable dilemma because it becomes precious, but then they're not sleeping. Just speak to sleep in general, whatever you can help us with.
Well, I definitely don't have any magical words
Sure.
of wisdom here. But what I will say, Barbara, is I think your question is highlighting the scarcity of autonomy in a caregiving role, and that I think sacrifices have to be made or trade-offs have to be made. And I think the only comment I'll just make is just the importance of being thoughtful about what's being prioritized and what's not being prioritized. So there's not enough time in the day for anyone, but I'd say especially for caregivers, to focus on all 6 pillars every single day. So I think, again, just having an awareness of that as a stressor itself, time limitation, and then to think critically about to ask yourself actually the question, what is the best use of my time now? What do I need in this moment? Is one question that is very powerful that we used to do a group visit focused on self-compassion or self-kindness. And one of the takeaways was really emphasizing this question, what do I need now? Some nights it might be sleep. Some nights you might be exhausted. And the best thing you can do for your mind and your body is to get right into bed. And on some nights, maybe you're a little tired, or maybe you can sleep in the next day. It might be more beneficial to exercise, or it might be more beneficial to cook a healthy meal, maybe that you won't even eat that night, but you'll have leftovers for the rest of the week. So you're not running to Dunkin' Donuts or to Starbucks or to McDonald's to get lunch and then stressing about that. Maybe it's connecting to a friend. Maybe it's reading a book. So I don't have any way to I think to appropriately value sleep versus the other pillars, but I would recommend again, building an awareness that limited time is a stressor itself. And then to use that as a prompt, basically, to think through what do you need in that moment, which might change day to day, and then to choose what you do very, very purposefully or very meaningfully.
Thank you. I have one question on behalf of what I often hear. At the very beginning, you spoke about inflammation as such a key element to chronic disease. Individuals are talking about supplements, which they hear combat inflammation. And again, I know that could be a 4-hour lecture, but I hear a lot about, what do I hear a lot about? Cinnamon or turmeric, but is there a few comments you can make about that? Are there, in general, recommendations for anti-inflammation?
Yeah, so actually you don't need 4 hours from me. I'll give a very short response, which is I generally do not comment on supplements for my clinical care.
Okay.
Which isn't to say that there's not evidence or research around it. I personally find it hard to make general blanket statements around things that just aren't studied as well as they could be. And it's not the fault of supplements, it's the fault. There's a lot of reasons why supplements haven't been studied, but the main one is that drug companies don't make money off of supplements. And so we don't have large research studies that have randomized and controlled for a lot of the factors that might influence the results from research. So yes, I'm familiar with turmeric, I'm familiar with omega-3 fatty acids, I'm familiar with many antioxidant fruits and vegetables that are purported to reduce inflammation. I think there's definitely evidence that supports them. I just don't know of any very strong evidence, very solid evidence from large randomized control studies that have looked at large patient populations from diverse backgrounds. So I generally don't comment on it. I will say that for those of you who are interested, at MGH specifically, there is one resource that you might want to look to for someone who knows a lot more about this than I do and talks more authoritatively about this is Dr. Uma Naidu. She is a nutritional psychiatrist and has recently wrote a book and did a book tour. And I don't know if you all know her, but anyways, she spends a fair bit of I know that she has looked into a lot of the research and has written a lot about the impacts of anti-inflammatory supplements and foods on the brain. But it's one area that I purposely try not to comment on.
Well, we respect that. And I don't know if I spelled her name correctly. Umanaigu, maybe?
Nid as in dog.
N-I, one more time.
N-A-I.
And yeah.
D-O-O.
All right. Thank you. We're just about approaching the end, but I wonder if you can sort of chat a little bit about where you began our talk. And again, if anyone has a final question or comment, please put it in. And that's about the square peg round hole phenomena, that our healthcare system is a disease model system and not a system of health, which of course, is profound and couldn't be more important. You, however, Dr. Mirsky, and your colleagues in lifestyle medicine are doing the work to change that model, and you have the evidence. So I suppose, what is my question? I mean, I want to comment on that. I feel very proud to, as an MGH employee of many decades, to know that my hospital is doing this under your leadership and others. But are you hopeful? I guess the question is, are you hopeful, because we have the largest program, that this will unfold in public policy? Because it takes policymakers too.
Yes, I'm cautiously optimistic, certainly. And as I said before, I think with any stressor, it's important to ask, can I change this or not? And for whatever reason, feel like I can change it and have tried to. And I think I'm extremely fortunate to be supported by many, many people at MGH in particular who believe in this vision. So the leadership in MGH Primary Care has invested an enormous amount of time and energy and money into our program. You had mentioned the food pantry at MGH Revere earlier. I'm not sure if some of my colleagues are on the call who I think might be or said they're going to be, but suffice to say that our food pantry at MGH Revere, we're having a ribbon cutting tomorrow with many people that were very proud and happy to be here who would not be there if we hadn't pushed for this idea that people with food insecurity deserve to eat fresh, healthy foods. And as a result, I'm hoping we'll get local attention, and if not local or beyond local, national attention. And I will say, the White House had a conference on nutrition, health and hunger in the fall, which was the first time in 50 years that there was a White House-led conference. There's a growing movement in food as medicine. Lifestyle medicine itself is the fastest specialty within internal medicine or board certification process. So there's definitely interest and movement. And I think in many ways, I'm not really sure that there's an alternative. I think we have demonstrated quite clearly that building a healthcare system that focuses on treating people once they're sick doesn't work. We have the most expensive healthcare system in the world and among the worst outcomes among our peer nations in many different ways. So I think we have to change. And I think as we shift, there's going to be more and more emphasis on prevention and on health promotion. We already see it. And some of you might be familiar with Medicare Advantage plans and understand that the insurance world is moving away from fix everything mentality and more towards prevention. So I think there already are some significant headwinds. And I've been very fortunate in MGH and specifically at MGH Revere to be surrounded by folks who really believe in this. And I'm quite confident that we're building momentum.
Well, thank you. Thank you so much. On behalf of Dementia Care Collaborative, on behalf of our audience of people with dementia, family members, people interested, others interested in good health, you have been an inspiration tonight to us. And to everybody on the call, again, you will receive the slides, which hopefully will be very helpful to you. And also, we send out automatically tomorrow an evaluation request to you. You can respond anonymously, but I will respond anonymously. They come to some computer system, but I want you to know that we really review them. In fact, Dr. Mirsky is here tonight because I'm the committee that has reviewed requests over time. We want to know what you want to learn and what's important to you. And so please respond. Please keep coming. There is, important comments. Dr. Penny says you look beyond the disease and the whole person. Bravo and thank you from Penny. Nancy says fabulous and helpful. Thank you. And Susan says thank you. This was interesting and informative. So we thank you, Dr. Mirsky, and I wish you all a good evening.
Thank you. And if it's okay, I'll just take one final moment and say a thank you to all of you and just to express my appreciation and gratitude for the hard work that you all put in taking care of family members and loved ones. As I said, I started my journey in medicine with working with folks with dementia and their caregivers. And then also to say more personally, over the past 10 years, I've seen as my mom took care of her mom with dementia and my dad took care of his dad with dementia. And it's a gut-wrenching and at the same time, really beautiful process to see and to witness. And so to all of you who are taking care of family members or who have, you deserve a Zoom round of applause or a sense of appreciation. And so thank you for all the effort that you put into the care of your loved ones. And thank you for taking time out of what is certainly a busy schedule, as was alluded to in one of the comments for Hearing Talk. So I hope it was helpful. And thank you again for coming.
Great. Take good care, everyone. Thank you so much. Have a restful evening.